As another part of my health supplement series, today we're going to be learning about St John's Wort, which is used to treat depression and low mood, and you can buy it over the counter as a herbal supplement. It's been used for hundreds of years actually to treat wounds and mental health. In fact, the name Hypericum perforatum actually means greatest health in Greek. So is it effective? Is it safe? And should I be recommending it to my patients to use? Let's find out. St John's Wort is, as I mentioned, one of the most popular over-the-counter herbal medications, but actually it would be better considered a drug because it does have pharmacologically active ingredients. So is it effective? Well, actually yes. It hit the news back in 2008 because a Cochrane review found it to be better than placebo and just as effective as standard prescribed antidepressants, but with reduced side effects. Well, that sounds really good, doesn't it? So why do NICE, the National Institute for Clinical Excellence in Health, tell doctors not to recommend it to their patients? Well, this is because St John's Wort is what's called a cytochrome P450 inducer. This meaning it interacts with loads of other medications. So for example, if you take a hormonal contraceptive like the pill or the implant, it can reduce the efficacy of those, causing potentially breakthrough bleeding or worst case scenario, an unplanned pregnancy. Eek, that's a big one. Also affects warfarin and other anticoagulants. It affects blood pressure medications and statins. It can even affect epilepsy drugs and anti-cancer drugs. So certainly lots of interactions that are really serious and have to be taken into consideration. Okay, so that's slightly worrying. Also, because it's a herbal medication, it isn't regulated like normal drugs. There is a variability in preparation when you buy it over the counter. We don't quite know what dose you should take and we don't know how long the effects last. And these are the reasons that NICE suggest we don't recommend it. If, bearing all this in mind, you still want to give it a go, make sure you're not using it alongside your traditional antidepressants. And if you want to swap between them, you need a little washout period between the two. So it's probably effective, but just because it's herbal, don't consider it to be safe. Herbal does not equal safe. That's a key thing to remember from this video. If you take away anything, take away that. Herbal does not equal safe. But it might help you, St John's Wort, if you consider all of those issues we've discussed and want to still go ahead. It's probably still a good idea to discuss it with your doctor if you're unsure and get clarification on if it's the best thing for you to try. I hope that helps. If you enjoyed this, do like and subscribe. Look out for some of my other videos on health supplements and more, and I'll see you next time. Thanks, bye.